Well, new research shows accessibility to mental health services is getting worse, and people are getting frustrated with the government that support is not improving. Let's go to Redbridge Group Director Simon Welsh now. Simon, you've looked at this in the past, and this does come up in focus groups. And really, in the past, when we've talked about, there was kind of a shared blame as to why services aren't up to scratch. But it seems like a lot of people are looking at the government now for the answers.
Yeah, thanks, Laura. Mental health is becoming sort of such a prevalent and prevailing issue. Whether we're talking to people about cost of living, whether we're talking to people about education or housing, it's all tangled up with mental health. And as you rightly say, there's this increasing kind of frustration with the lack of improvement around mental health services. And I think one of the interesting things around that, and this is sort of also a bit of a sort of signal of just how deeply people are engaged with this issue. When you start to see real nuance around an issue, then you know that people are thinking about it a lot. They're not just coming to a focus group to talk about it, they're thinking about it in their everyday life. And what we're sort of seeing is this, yes, frustration that the services aren't improvement. There was still 2+ year waits to get their kids in to see a psychiatrist, horrific stuff, horrific stories. But there's this growing frustration as well that everything we're doing is geared towards this kind of reactive system. And there's this sort of growing perception and realization perhaps that we can't just throw money at the system as it stands today and expect things to get better. So people are talking about, we need to do things differently. We need a sort of a more proactive kind of system rather than this kind of reactive, trying to fix people once they're broken kind of system. Now, they're not exactly sure what that means in policy terms, but what they're really looking for from government is this kind of policy leadership around mental health that goes far more than just sort of, as I say, sort of just throwing money at a broken system or promises that kind of don't get delivered or can't be delivered for 10+ years sort of thing.
I mean, if you're asking me, I think it should be part of the productivity roundtable. I mean, mental health, nothing works if you don't have your health, be it mental or physical. And that goes for an entire workforce in Australia. But more generally at the moment, Simon, what are you finding in the groups? Is there certain frustration about the federal government? Is there a disengagement? Is there a view on the coalition, a view on state governments? What's coming up at the moment?
Yeah, in general terms, if you get outside the specifics of an issue like mental health, in general terms, there's a bit of a sort of a political hiatus at the moment. I hesitate to call it a honeymoon period because it's not that people have suddenly become a bit more positive about the government. It's just more an absence of sort of opinion and sort of formed view in those sort of strict party political kind of terms. So when you talk to people about what's on their mind, politics is not on their mind, but those same issues of cost of living, housing, like all those things that were there through last year, and we sort of stopped talking about once the election was over. Those things have not gone away. Those conversations continue to be had. So while the party political dimension of that is gone, and it's just a function of people not thinking about sort of a vote intention or anything like that. They're quite happy to put the election behind them. But those core issues are still there. And I think that's really important for all of us involved in the political world to note that just because the election finishes, the cost of living pressures, that people making huge sacrifices to put food on the table, the housing pressures, 1 or 2 interest rate cuts doesn't fix all that. And those things are still there and they are still significant. And as I say, leading to people worrying about their own mental health, their kids' mental health. Like the effects of this stuff is really quite profound and shouldn't be forgotten.
No, well said. Simon, thank you. Appreciate that.
Thanks, Laura.